Anatomy 32, Chapter 11, the muscular system, topics, muscles of pelvic region and muscle disorders. So we are now moving down to the floor of the torso, the pelvic floor. There are a number of muscles here that have a variety of functions. This includes the external urethral sphincter. The external urethral sphincter, very important in constricting the urethra to allow us to voluntarily inhibit urination. So it helps to allow us to control urination. And then also the external anal sphincter. The external anal sphincter being important, of course, to close the anal opening or to relax to allow for defecation. Then we have ischiocavernosus. Here it is. Ischiocavernosus stretches along the pubic bone. Ischiocavernosus helps to maintain clitoral and penile erections by going to the base of the clitoris or the penis. And then there's the bulbospongiosis. Bulbospongiosis, as you can see here in the female body, goes around the vaginal opening, so it helps to narrow the vaginal opening, compress and stiffen the clitoris. Or in the case of the male body, helps to eject urine and semen and compress and stiffen the base of the penis. So again, here it is going around the vaginal opening. Here in the male, ischiocavernosa running up the sides, and bulbospongiosum going up the base of the penis within the torso. All right, then we have ischiococcygeius. Ischiococcygeius obviously goes from the ischium to the coccyx bone. It helps to support the pelvic viscera, the organs found in the pelvic region, and it can pull the coccyx following defecation and childbirth. And then a collection of muscles, a muscle group as it were, called the levator ani muscle group that are found forming the floor of the pelvic floor. So basically they form the pelvic floor and they support the pelvic viscera. Again, this is a muscle group basically helping to prevent and support the organs so that they don't fall through the torso. That would suck. All right, so here's a view from a cadaver. Here is bulbospongiosum running up the penis. Here's the ischiocavernosa going up toward the base of the penis. Here is levator ani, all of this muscle tissue here, ischiococcygeius, and of course the external anal sphincter. Some disorders of the muscular system. We have Bell's palsy. This is facial paralysis, where one side of the facial muscles are paralyzed, and so the person is unable to form facial expressions on that side. There's strabismus. This is a condition in which the two eyeballs are not properly aligned, also known as a lazy eye, caused by one muscle for one of the eyes not functioning properly. There's dysphagia. Dysphagia is the clinical term for difficulty in swallowing, and there are a lot of muscles that could lead to dysphagia if they did not work properly. There's rotator cuff injury, a strain or tear of the rotator cuff muscles. Golfer's elbow, condition caused by strain of the flexor muscles from, again, repetitive movement, say in the muscles associated with the medial epicondyle of the humerus. Groin pull, which is a rupture or tear of muscles in the thigh that move the leg medially, aka the adductor muscles. Pulled hamstring, pulling or partial tear or strain of the hamstring muscles, and a shin splint syndrome, which is pain or soreness along the tibia caused by tendonitis, inflammation of the periosteum of the tibia, or stress fractures within the tibia. And that is it for this lecture.